Okay, good afternoon, everybody. Namaskara. I've been given a very important responsibility by nasscom because I'm between you and lunch, so I'll try and make it a little light. Hopefully, I intend to be a little, motivate you all and look at healthcare, right? So many young technologists. How many of you have been to a doctor's office at 11:30 appointment and a 1 p.m.? Okay. How many of you have a smartwatch with you? Okay, quite a bit. How many of you look at your steps? Do you have a target? That's quite a bit. Okay. I've had my own share of health issues. I believe it is my obligation that I have to do something for healthcare, and I've chosen a path to do that through health tech. I'm fortunate enough to work in a company that tries to innovate using technology to enable better patient experience, right? And I believe, I was really excited to see so many young technology folks here because I believe the future of healthcare is largely in your hands, and we'll talk through that. Okay, let's travel through time. Any of you have done that? Okay, we'll try. I'm going to take you to some time in 2035, somewhere in southern Bangalore, or southern India rather, and we'll meet two individuals. We'll meet Raghav and we'll meet Radha. Similar, like you and me, okay? Here we are, 6th August 2035. Raghav, probably a young software engineer, mid-30s, diabetic, hypertensive, but doing pretty okay. He's still yet to have his filter coffee for the day. His wearable pops up an alarm. Anomaly detected, visit the nearest health pod. So Raghav sets off. He reaches the health pod at 9 a.m. I mean, Bangalore traffic hasn't changed, irrespective of so much of innovation. He reaches the health pod. He gets into it, undergoes a series of, right from blood checks to scan and everything else. All AI, everything AI does that in the back end. And he receives a message that an anomaly is being detected in his heart, some cardiac risk. And a virtual consultation has already been scheduled by the AI. No paperwork, no queues. 400 kilometers from there, in Gadak, we have Radha. She's a farmer, visits the panchayat office for a routine health checkup, gets into the same health pod. Everything is validated with a Aadhaar-based biometric device, goes through the scans and all that, receives a message that there is a risk in a cancer marker and requires cancer screening. Again, a virtual consultation has been scheduled by the AI. And the beauty here is AI has determined the symptoms or seen the symptoms probably even before it physically manifested, right? Both of them, same day at around 2 p.m. respectively, get into their virtual consultations. They have the privilege of meeting doctors, the best in India, across India, through a virtual consultation process. AI probably helped in language translation where necessary. There's a digital consent process that is enabled. And both of them were critical. So AI helped triage the cases to make sure they get their immediate attention. Now, same day by evening, Raghav gets the diet he needs to follow, the medication that he needs to follow, the lifestyle that he needs to follow, probably all synced to his wearables. Radha, on the other hand, receives a list of things that she needs to comply with, closely working with her probably healthcare professional in her town, village, whatever. If you notice, the beauty of all this is everything happened the same day, instantaneously, and very fast, right? We'll go on. What happens a week later? Raghav finishes his yoga in his terrace, quickly looks at his wearable. His lifestyle, is it as per what the doctor advised? His heart, stress, everything, is it in line? On the other hand, Radha has to do her farm work. It's harvest season. So the health professional actually comes down there with a remote diagnostic device that ensures that all her vitals are okay. She's progressing on track. Friends, this to me is health tech. Not just high tech, but health tech that is more personal and health tech that's more human. I believe the future of health tech will be more predicted. The future of health tech will be more personalized. And I strongly believe the future of health tech will be built by people here in this room and here in this country. Now, we'll come back to today. What is the problem we are trying to solve with technology? 70% of our population, approximately, live in rural areas, but have the privilege and access of only 30% of our doctors. On the contrary, the privileged us, about 30% of our population, have access to about 70% of healthcare doctors. So for all that we say, healthcare in India is not truly accessible, and I think technologists such as you will be able to crack that. Close to about 50% of Indian healthcare is funded by people like you and me from our wallets, right? So a single critical illness can make our families bankrupt. A single critical illness, right? I strongly believe technology and technologists such as you will be able to make healthcare more affordable. And therefore, I think the future of healthcare lies with technologists like you and the coding that you guys will do, right? So I therefore believe that you all play a very integral part in the future of healthcare, and I strongly believe by 2030, our healthcare system will be better than anywhere in the world. Okay, how are we going to achieve this, right? So let's lay out a framework. This is my framework, so maybe right, wrong, but this is how I believe this will go. Prediction, predicting, but predicting with the use of technology even before the symptoms manifest, and I think that's what technology will be able to help us achieve. Validation, right? I mean, this is just prediction. How do you clinically validate that it is accurate? But how do you validate this anywhere but instantly, right? Plan. We all go through, whenever you are ill, you go through a care journey, right? But how can this care journey be participative? It's not like the doctor and somebody discuss and you do. How can we be participative in our own care journey? And that's what I think will be critical as well. Planning was more, how can it be personalized, right? I mean, you have a headache, what do you have? Dolo. You have fever, what do you have? Dolo, right? You have Dolo for anything, so it's not personalized. So the idea is how can the healthcare journey be more, personalized, and that'll be critical. Participative is, how can you and me as patients be participating in that journey? I'm going to share with you a few examples. By no means these are exhaustive. This is just what I have encountered, had an opportunity to speak to somebody that's involved in these companies, or I have read about, right? But just to give you a flavor of what technology is already doing. Now, everything that we discussed earlier is not really a science fiction. I mean, we are already progressing towards it. Today, by 2030, India will have 500 million wearables, right? We have 45 crore and counting virtual Ayushman Bharat digital cards, about 160 million virtual consultations that we do. And we have numerous startups helping in predicting diseases even before symptoms appear. So all this is already happening, right? Okay, we'll go with prediction, right? GoQI is a startup. They have wearables that will determine a cardiac risk, right? How do they do that? Heart rate variability, SpO2 levels, ECG, using edge-based AI. It's already happening. Cure AI uses deep learning to be able to scan through your CT scans, X-rays, and their algorithms have been trained by millions of images. Now, of course, they're used in many countries now, but they have been able to detect TB with an efficiency of 25% better than what we've been able to do, right? So imagine the power. And then you have Swasa. This is an ML-based algorithm that listens to you cough, just listens to your cough, and determines your respiratory condition. And they've had about 85% accuracy in their pilots in Telangana to determine TB. So we have numerous apps now, or companies now that are able to use AI technology, edge AI, and real-time diagnostics to be able to predict, right? So this is already happening. Keep looking at possibilities as we go through this, right? Okay. Now validation, as we spoke, how can we do this anywhere, anytime, like a pod, right? I mean, just sit there and get a detailed diagnostic. Nirmal AI is a great example that uses thermal AI technology to be able to scan and determine any risk of breast cancer. Now this is non-invasive, this is affordable, and this is scalable. And they've done more than 600,000 scans and counting. YOLO Health Pod is interesting, something very similar to the time travel we did. They have a health pod that determines diagnostic of various ranges in about 15 minutes using IoT technology that is linked to your unique health ID. And they have deployed all this in tier 2 and tier 3 cities to make diagnostic more accessible. Coming to healthcare, very interesting, right? We all need to go through diagnostic. You need lab scans to be done. So they put this all in a briefcase. Everything, lab-grade technology in a briefcase that can go to the remote part of the country with solar power, no internet required, and able to do about 30 plus diagnostics in a matter of 3 to 12 minutes. Your cholesterol, sugar, blah, 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 blah. Right? Again, taking diagnostic to where the patient is. Of course, their technology that they use is again linked to the electronic medical records and so on, right? So companies such as this have democratized using technology, right? And bringing care to where you are rather than you having to go and look for care. Now, I personally believe that planning a healthcare journey is critical, right? I mean, every human being is unique. We have different dietary conditions, we live in different conditions. Therefore, personalization of the care is very, very critical. We have eSanjeevani, which is a web RTC, enables virtual consultations, linked to your medical records, linked to your unique health ID, has been successful in about 160 million virtual consults and counting. 5C network, very interesting, uses their smart triage with AI, and they're able to determine and prioritize radiology scans. And have proven turnaround time improvement by more than 90% in about 2,000 odd thing, right? So better utilization, making sure the most important person, critical person gets care immediately. IU Health again uses hospital dashboards and AI, electronic medical records, to be able to improve the administrative process in hospitals, saving more than 15% in administration time. So what does that do? When you save time in administration, you're able to ensure that you focus on patients and therefore determine better outcomes. I don't know how many of you have gone to a doctor and the doctor will ask you, but the doctor's busy typing, right? So hopefully things like this will improve administrative time, right? Okay. Let's come to participation again. Dozo has enabled the hospital beds into smart ICU beds. They're able to assess a problem before and therefore reduces nurse overload by 30% using their BCG technology. BTO, I think probably many of you may have heard this or probably using one version or the other. A Bluetooth-enabled glucometer constantly looks at our blood sugar levels, right? Any spike nudges you at WhatsApp for an activity. More than 17% improvement of blood sugar levels in 6 months. GoQI, again, tracks your lifestyle, gives you nudges on better lifestyle, has shown an adherence about 28%. So these are examples where various range of technologies have been used to improve the healthcare journey, improve participation, empowering the patient, right? Okay, to do all this, you need a health stack. You need a technology stack. And I think India has one of the most amazing stacks that is already in place. You have your Ayushman digital mission, that's technology stack, where you can already deploy, test in the sandbox, and start integrating to the mainstream available. India has, like we all have Aadhaar numbers, you have your Aabha numbers, which is a unique ID for every citizen in India so that things can be integrated. How do you obtain virtual consults? So we have our DEEPA that enables to do that. So many apps, how do they communicate with each other? So you have your FHIR to be able to do that, right? You have your e-rupee for payments and so on. India's, what I'm really proud of is our healthcare stack is extremely open. I mean, anybody can, it's open. It is interoperable, so irrespective of different technology, they can communicate with each other, and more importantly, it is scalable. So to this, you add AI, you add ML, and unleash the potential that is already there. So all this is, by the way, is something that you can all work on the sandbox and try out, right? I've been in technology, healthcare for a very long time, and I've learned one big lesson. As a technologist, don't assume that you can make changes in healthcare in isolation. It doesn't happen, because it's human body, it's a human life. We need to work closely with healthcare professionals, doctors, very, very critical. Policymakers, because as much as you do, only policymakers, bureaucrats, and the government will be able to take this to the last mile, so very critical. And people like you and me, I mean, if you design a system that you and me don't find it intuitive, it's not going to work, right? Let's build systems not only for our urban areas, but for our rural areas as well. Let's build systems that, where healthcare is more predictive, healthcare is more participative, and also healthcare, I strongly believe, is something that will be coded by each of you, right? Like I said, I'm extremely passionate on healthcare. If you have any thoughts on what we can do to make healthcare better with use of technology, you can connect with me on LinkedIn. It's been a pleasure. Thank you so much.